More than 30 million Americans have gone without health insurance during the pandemic. We recently looked at how several other high-income nations cover their entire populations for a lot less money than we spend. But does a universal health care system help a country respond to a pandemic? For answers, William Brangham, along with producers Jason Kane and Claire Muffson, look to our northern neighbor, Canada, and its single-payer system. This story is an excerpt from our upcoming NewsHour documentary, Critical Care: America versus the World.
I would say about the seventh day, I woke up with this massive headache, just pain in my skull, my neck, my spine. I've never felt anything like it before.
Ruth Castellano started feeling sick from the coronavirus last May. Her symptoms kept progressing.
Good boy.
And then one night at home in Flamborough, Canada, it got worse.
I woke up and I couldn't breathe. My husband was sleeping. My dog was sleeping. I was trying to wake them, but I didn't seem to have strength in my arms. I thought, I'm gonna go. This is my time. And I just looked at my husband one more time. And then I just said, okay, I need to just be brave because this is gonna happen.
155,000 doses of Pfizer arrived.
The immediate crisis passed, but her other symptoms didn't. They were so constant, she had to quit her 2 jobs. Castellano struggled at first to find a doctor who'd listen and not blame her symptoms on anxiety.
I tried to get some food and it was so much work. I couldn't even get it out of the car.
She captured her anguish in this video.
I'm in so much pain.
She's now a COVID long hauler, takes 20 different pills a day, and sees a neurologist, a cardiologist, and a pulmonologist.
I have an appointment next Thursday.
While she has to live with this chronic condition, because she lives in Canada with its taxpayer-funded universal healthcare system, at least she doesn't have to worry about getting good care or affording it.
That's all part of our universal health care. So I'm not paying any of those bills.
But does a universal system help more broadly when a pandemic breaks out?
Welcome back.
Dr. Danielle Martin is a family doctor and executive vice president at Women's College Hospital in Toronto.
The first and most obvious success of the Canadian healthcare systems in response to the COVID-19 pandemic is that if anyone has symptoms of COVID-19, they've been able to access testing free of charge, and heaven forbid if you require an ICU stay, if you need to be intubated and ventilated, all of those things are covered under the public system.
Martin notes that Canada has lost many thousands of people to COVID and has struggled in parts with its response.
This is one of the things about COVID-19. It's exposed in every country, the places where you've built something strong from the foundations up, and it's also exposed the places where you're running around trying to patch things on in order to make it work.
Canada is a single-payer system, though here, each of the 13 provinces and territories control their own system. Doctor and hospital care is covered, but major gaps do exist. One example, most medications outside the hospital aren't covered, but supplemental insurance, which most people get through their work, picks up the slack. During the pandemic, Canada has had much better outcomes than the U.S. Its overall death rate is about 3 times lower than America's.
So we have built quite an effective system within Ontario to respond to COVID-19.
Dr. Kieran Moore is the head of public health for Kingston and the surrounding region in southern Ontario. This holiday destination could have easily become a COVID hotspot, but this area of roughly 200,000 people has had only 2 deaths during the whole pandemic.
That's the benefit of having a universal healthcare system, because all partners are working together. There's not a private-public separation of responsibility.
Well, that's in her period of acquisition, and you said that was a week and a half ago?
Once a positive case is identified, nurses spring into action.
Our records indicate that you were exposed on February 14th.
With daily calls, they make sure people are safe, staying home, and not spreading the virus.
All right, so you haven't traveled outside of the province in the last 14 days?
Public health departments can levy serious penalties if you don't.
You can be subject to a fine of $5,000 per day.
I had only seen what was on the news and it was all bad, so I was assuming the worst.
For a patient like Amanda Antwine, who tested positive last year, she got the kind of follow-up care that's often lacking in the U.S.
I got a call from the public health nurse every day, and if I was having a bad day, it was a couple of times. Any questions that I had, she would find out and get right back to me.
Canada's system has also largely avoided what we saw in certain parts of America, hospitals being overrun and straining to care for a surge of COVID patients.
We haven't experienced anything like colleagues in places like New York City have experienced or elsewhere in the world where they were hit the hardest.
Dr. Hannah Wunsch works in critical care medicine at Sunnybrook Health Sciences in Toronto. Because hospitals here operate within a coordinated system,
it's been really busy up here.
An oversight board like this one can shift patients from stressed facilities to those with extra capacity.
We have over 50 patients in the hospital, 15 in the unit, 14 ventilated.
That often didn't happen in places like New York during the early days of the pandemic.
Baseline U.S. hospitals and health networks are very much competing against each other. And so while many of them have learned to function together over time out of necessity, it's not baked into the system, it's not inherent to the way they function in normal times.
But Canada's experience also shows the gaps that can occur when a country achieves universal care but stops there. Canada has seen many of the same problems we've seen in the U.S. with our fragmented system. The vast majority of Canada's COVID-19 deaths, roughly 70%, have occurred in long-term care facilities, most of which aren't a part of the public system. The toll has also been particularly hard on marginalized communities.
Really, to me, what COVID has exposed is that the pre-existing condition has been chronic neglect.
Dr. Andrew Buzari teaches public health and also works at a clinic serving people experiencing homelessness.
We can't say that we have a perfect system. We can't say that we have one when you think about our shortcomings on drug coverage, on access to mental health and supports, to the social supports taking place. You really can't say that we've completely figured this out. And really, when you think about the brunt of who's had to be punished by our failure to do so, it's been marginalized communities, racialized populations, and really people living in poverty.
Have you been in contact with anyone with those symptoms?
No.
And then there's the issue of vaccines. If there is anyone in Canada who should be near the top of the list for vaccination, it's 80-year-old breast cancer patient Ruth Ann Warham. Her cancer care, she says, has been superb.
Out of this world, fantastic. I have been so blessed.
But she, like millions of other older, medically vulnerable Canadians, was still waiting to get a vaccine in late February when we visited. A complicated negotiation with vaccine manufacturers and a failure to invest in its own drug production and delivery put Canada far behind the U.S. And today, only 2% of Canada's population has been fully vaccinated, compared to roughly 22% of Americans.
There's your guy.
That's my doctor.
But Warham's son, Cece, who's a professor in the U.S., is glad his mother lives in Canada.
With the death rates in the States compared to what we've had here, I guess I'd rather be waiting for a vaccine than have, 3 times the per capita deaths. That's what we can sort of look at.
10.
Ruth Ann was confident the vaccine issues would be smoothed out soon. She told us how angry it makes her when she hears politicians in the U.S. demonize her nation's healthcare system.
Why wouldn't it make me angry? I have this ability to go to a doctor when I need it, and not just me, but my next door neighbor who's working at the McDonald's at a low income wage. Why is the system down in the States so adamant against it? I can't understand that. I just can't understand it.
We share a common border, but have 2 very different outlooks. And as yet another spike of infections hit both countries, with new variants spreading quickly, several Canadian provinces have imposed new restrictions, while in America, it's largely full steam ahead to reopen. For the PBS NewsHour, I'm William Brangham.
Our full documentary, Critical Care, America versus the World, airs on PBS stations starting April 21st.